Hi guys, and welcome to our module on the thoracic cage. Thoracic cage is the skeletal framework of the thorax. It is akin to a number of structures found within the body's system. Like, for example, in the pelvic region, we have the pelvic girdle that tends to form this framework around the pelvic cavity. And then in the head, we have the skull that tends to form a form of skeletal framework around the brain. The reason why we have this in the thorax, just as we have in every other aspect of the body, is to provide protection. So thorax contains very vital organs to the body, including the heart and the lungs. And as a form of protection, we have the thoracic cage forming a form of casing or prison around those two vital structures. The thoracic cage is truncated in shape. It looks like a form or a truncated cone in shape, shown in the image below, and is made up of a combination of different bones, the ribs being one, the sternum, the vertebrae, and then the costal cartilage uniting them. There are three major walls to the thoracic cage. The three major compartments of the thoracic cage includes the anterior wall or anterior compartment that is formed by the sternum and parts of the ribs. Then the lateral wall of the thoracic cage is formed largely by the ribs and intercostal spaces between them. And then finally, the posterior wall is formed by the thoracic vertebrae and then the extension of the ribs towards the back. So that is shown in the image below. You see that the anterior part of the thoracic cage is formed by this structure in green, which is the sternum and the costal cartilages at the side. Then laterally, we have the ribs extending to the back, which is shown in blue. You can see the ribs are numbered from 1 to 12, and we have spaces in between them. Those spaces are known as the intercostal spaces. Then at the back, not labeled in this particular image, but we could see the vertebral column, the thoracic vertebrae specifically forming the posterior wall of the thoracic cage. The thoracic cage also has two major openings to it, one of which is connected to the neck superiorly, and the other connected to the abdomen inferiorly. So we have the superior thoracic inlet, or what we call the superior thoracic aperture, which is connected to the neck and is going to be containing structures that are found at the neck region and also extending down towards the thoracic cavity. And then we have the inferior thoracic inlet, or what we call the inferior thoracic aperture, which is connected to the abdomen. However, separated from the abdomen by a large muscular structure known as the diaphragm. We'll talk about that very soon. So let's dive a little bit deeper, talking about the bones of the thoracic region. We'll start with the very first, most anterior bone of the thoracic cage, which is the sternum. The sternum is a flat, elongated bone, and it tends to form the anterior wall of the thoracic cage as shown. You can see the image of the sternum just in the anterior part of the thorax. There are three major parts of the sternum. This includes the manubrium of the sternum, that's the area in blue, the body of the sternum, which is the largest and longest aspect of the sternum, and then the xiphoid process of the sternum, which is the tail end of the sternum located most inferiorly. Let's talk about the ribs. The ribs are the second important bones of the thoracic cage. They are the bones that form the lateral part of the thoracic cage. They are flat, curved bones. They're numbered from 1 to 12, 12 in numbers. And we talk about the different forms or different classifications of ribs. We'll talk about that in a different slide. And as I said, these are bones that tend to man the anterolateral and posterolateral walls of the thoracic cage, as shown in the image. We tend to classify ribs into two major forms. We can classify them based on their attachment to the sternum. We can also classify them based on their structural or anatomical features. So when we're classifying based on attachment to sternum, we have three major types of ribs. We have true ribs, which are ribs 1 to 7. These are ribs that are connected directly to the sternum through a costal cartilage. So they have their independent costal cartilage. So this is rib 1. You can see it's independent costal cartilage. This is rib 2. You can see it's independent costal cartilage. And if you notice from rib 1 all the way down to rib 7, they all have independent costal cartilages, and that makes them unique in the sense that they are true ribs in terms of true connection to the sternum. Then we have the false ribs. False ribs are numbered 8 to 10. These are ribs that don't have independent connection to the sternum, but rather they tend to have a single costal cartilage uniting with the sternum. So if you notice from ribs 8 down to ribs 10, you can see that there's a single costal cartilage connecting each of them. And the fact that they don't have independent connection to the sternum makes them false ribs. They are falsely connected to the sternum indirectly through a single connected costal cartilage. And then finally, we have the floating ribs. Ribs 11 to 12 are the floating ribs. They are ribs that have no connection whatsoever to the sternum. They are just hanging from the vertebral column posteriorly. These are the floating ribs as shown here. Ribs 11 and ribs 12 are the floating ribs. Based on structural features, we'll talk about the different types of ribs. Usually, we classify ribs structurally into typical ribs, that is from third rib or the rib 3 to the ninth rib 9. And we have atypical ribs. Atypical ribs includes rib 1, 2, rib 10, rib 11, and rib 12. And I'll talk about what tends to distinguish typical ribs from atypical ribs in the next set of slides. So talk about the general features of a typical rib. A typical rib has a head to it, it has a neck, it has a tubercle just directly inferior to the neck, it has a body or a shaft, which is the longest part of the rib, it has an angle, and finally it has a small portion on its inner surface known as the subcostal groove. Each of these are found in a typical rib, and each of these have very unique features to them that we only see in a typical rib as compared to an atypical rib. So the head of a typical rib has two demifacets, and these demifacets are present for articulation. If you notice, this is the head of a typical rib, and you'll notice that there are two articular surfaces here, or what we call demifacets, on the typical rib. These demifacets are present to articulate with the vertebral column above and below the rib. Then we have the neck. The neck of the rib just lies directly below or inferior to the head, as shown here. This is the neck. All right. And then beyond the neck or below the neck, we have tubercle of the rib. The tubercle of the rib is a bony prominence that tends to be distal and lateral to the neck. It has two parts to it. It has an articular part and a non-articular part. If you pay attention, you notice that there's an articular aspect of the tubercle here. Is the articular part that is lined by cartilage. And then finally, we have a non-articular portion of the tubercle here. The articular part is there for articulation to the to part of the vertebrae. So just as the head articulates to part of the vertebrae, the tubercle of the rib articulates also to part of the vertebrae. Then we have the body and the shaft. The body and the shaft is the longest part of the rib. You can see the body extends from beneath the tubercle all the way to the costal cartilage. So you see how the body of the rib tends to be curved all the way to the costal cartilage, and the body of the shaft of the rib tends to either be containing anterior and posterior surfaces and superior inferior border. So the superior border, as shown here, is the part that is pointing upward, the most superior part of the rib. The inferior border is the part pointing downwards, the most inferior part of the rib. And then we have anterior and posterior surfaces. The anterior surface is the part that is pointing outwards, and then the posterior surface is the part pointing inwards. And that's what we tend to describe in terms of general features of the body of the rib. Then, as shown, the rib in terms of its body has a curve to it, and that curve gives it an angle. So the angle of the rib is the bend of the anterior inferior part of the rib beyond the tubercle at the body. Then finally, we have a very unique aspect of the rib known as subcostal groove. If you pay attention closely, you notice that in the posterior surface of the rib, or the innermost aspect of the rib, there's a very tiny groove around this portion here, and that groove is known as a subcostal groove. That groove is clinically relevant in the sense that we have some structures that are sitting and protected by the groove. These structures are the neurovascular structures of the intercostal spaces. Now let's talk a bit about the atypical ribs. Talk about the different forms of atypical ribs we have and what tends to distinguish each of them from one another. Starting with the first rib. The first rib is short in length, and that is one of its unique features. The fact that compared to other ribs, it's the shortest rib in the body. It has a single articular facet on its head, So remember that the head of a typical rib tends to have two demifacets to it. For the first rib, it has just a single facet, and that's one thing that distinguishes it from the other ribs. Tubercle also tends to have an insertion. The tubercle of the first rib has an insertion point for a muscle. That muscle is known as the scaling anterior muscle. So unlike the tubercle for the other typical ribs, which have articular and non-articular portion, for the tubercle of the atypical rib, like the first rib, it has a part where muscles tend to attach. And that muscle is known as the scaling anterior muscle. Then, unlike the typical ribs, the first rib has superior and inferior surfaces and anterior and posterior border, rather than having superior and inferior borders and anterior and posterior surfaces. If you notice, it is a flat rib that tends to sit rather than standing, and as a result, instead of having superior and inferior borders, it has a superior surface and an inferior surface. The superior surface is the part that's pointing upward, the inferior surface is the part pointing downwards, and then the borders, rather than being superior and inferior, are anterior and posterior. So we have an anterior border, and this is the anterior border um, of the first rib, and this is the posterior border of the first rib. Another important difference between the first rib and the typical ribs is the fact that it lacks an angle and it lacks a subcostal groove. So these are important points to note about the first rib. The second rib is a unique rib in the sense that, unlike the typical ribs, it has very similar features to the typical rib. The difference is in the tubercle. The tubercle of the second rib has an insertion point for a muscle. So typically, the tubercles for the typical ribs tend to have just the articular and non-articular part and don't really contain insertion point for muscles. But for the second rib, the tubercle of the second rib has an insertion point for the scaling medius muscle. Remember that the scaling anterior muscle tends to insert at the tubercle of the first rib. The scaling medius muscle tend to insert at the tubercle of the second rib, and that is what distinguishes it from the rest of the typical rib. So it has the head that has a double facet. It has the angle to its body. It also has the subcostal groove to it. The tubercle tends to be the difference. For the tenth rib has a head that has a singular articular facet, and that's what distinguishes it from the typical rib. So just like the first rib, having the head being or containing a single articular facet, the tenth rib also has a head that contains a single articular facet. Then the 11th to 12th rib has very unique features to that of the first rib. It has the head that contains a single articular facet. It lacks a neck and a tubercle. If you notice, you can see that the 11th and 12th rib are just uniquely placed. They don't have a tubercle, they don't have a neck, just the head that is continuous with the body. And then finally, they both lack a subcostal groove as shown in the image here. The third bone of the thoracic cage is the thoracic vertebrae. Thoracic vertebrae forms the posterior aspect of the thoracic cage as shown in the image previously. It is numbered from first thoracic vertebrae to the 12th thoracic vertebrae. So there are 12 vertebrae in total, and we can classify the thoracic vertebrae also into two major forms or classes based on their structural appearance. So we have the typical thoracic vertebrae and the atypical thoracic vertebrae. Usually, typical thoracic vertebrae tends to be from the second to the ninth thoracic vertebrae, T2 to T9, whereas the atypical thoracic vertebrae includes the first thoracic vertebrae, the 10th thoracic vertebrae, and then the 11th to 12th thoracic vertebrae. Let's talk about the general features of a typical vertebrae. So a typical vertebrae would have a body to it. The body tends to be the anterior part of the vertebrae. This is the body of the vertebrae as shown here, also called the corpus. This is the body of the vertebrae in a lateral view. The body of the vertebrae of a typical vertebrae tends to have two bilaterally placed costal demifacets, one superiorly, one inferiorly. So you can see one superior costal facet on one side, another on the other side, just on the right side. And on the left side, we have the same thing, one superior and one inferior. So we have a total of 4 demifacets, two bilaterally placed, two on the right, two on the left. And that's what we see for the body of a typical vertebrae. And this costal facet serves as a point of articulation with the head of the rib. Remember, the head of the rib has two demifacets to its head, and these two demifacets tend to articulate with the demifacets of the body of the typical vertebrae. Then typical vertebrae also has a transverse process. So transverse processes are bilateral extensions of the body of a vertebrae of the thoracic vertebrae. And the transverse processes of the thoracic vertebrae, in terms of a typical thoracic vertebrae, tends to be unique because it has costal facets to it. So there are costal facets to the transverse processes of the typical thoracic vertebrae. So this is the the um the transverse processes shown in the image. You'll notice that each of the transverse processes on the right and the left side has a costal facet to them for articulation. The costal facet on the transverse processes of the thoracic vertebrae are present to articulate with the tubercles of the rib. So remember that the tubercles of the rib has articular portions and non-articular portions to it. The articular part of the tubercles of the rib is involved in articulating with the transverse process of the typical thoracic vertebrae. And then finally, we have the spinous process of the thoracic vertebrae. We have a single spinous process of the vertebrae, and that spinous process tends to be a long spinous process as compared to spinous processes of the um, atypical vertebrae or other vertebrae in the body. So look at the spinous process of the vertebrae, extremely long, and it tends to be inclined more inferiorly. And these are unique features of the typical vertebrae as compared to the atypical vertebrae, which we'll talk about in the next slide. So what are the differences between the typical and atypical vertebrae? Let's start with the first vertebrae. The first vertebrae tends to lack a superior costal facet. So unlike the typical vertebrae that have demifacets bilaterally, one superior costal and one inferior costal on the right and the left side, for the first vertebrae lacks the superior aspect of the costal facet, and that is what is unique to it. That's what distinguishes it from the typical vertebrae. For the tenth vertebrae also has a single bilateral costal facet. Instead of having a superior and inferior, it just has a unique costal facet, a single unique costal facet on the body. So instead of having just one superiorly, one inferiorly, for the tenth vertebrae, it just have a unique costal facet on one side, probably located on the center part of the body. And this is important because remember that the tenth thoracic vertebrae, being atypical, tends to articulate with the tenth rib. The tenth rib has a single demifacet on its head. And because it has a single demifacet on its head, or it makes sense that it is going to be articulating with a single bilateral costal facet on the body of the tenth vertebrae. So just remember that the tenth vertebrae is atypical. The tenth rib is atypical. The tenth rib has a single um, facet, demifacet on its head, and then the tenth vertebrae has a single bilateral costal facet on its body, and as a result, that leads to perfect unity between both vertebrae, both bony structures rather. Then we have the 11 to 12 vertebrae. The 11 to 12 vertebrae also has a very unique feature in the sense that it has single bilateral costal facets, just like the 10th vertebrae, and that's because the 11th and 12th vertebrae also has a single facet on the head of the rib. So let's talk briefly about the joints of the thoracic cage. We have a number of joints that tend to be formed from different bony structures of the thoracic cage. Remember that we talked about different bones, starting from the sternum to the ribs to the vertebrae, and each of these bones tend to unite together to form different joints. We'll talk about the important ones to note. So starting with, we have the manubrosternal joints found in the sternum. Manubrosternal joint is the joint formed between the manubrum of the sternum and the body of the sternum. So this is the joint here, the joint between the manubrum and the body. And what is unique to remember about the manubrosternal joint is that it is a secondary cartilaginous joint, or what we call a symphysis. And it's one of the few examples of secondary cartilaginous joints in the body. Then we have the xiphoesternal joint. The xiphoesternal joint is the joint between the xiphoid process of the sternum and the body of the sternum. So this is the joint here. The unique thing about the xiphoesternal joint is the fact that it is also a secondary cartilaginous joint or a symphysis. Then moving on, we'll talk about the first sternocostal joint. The first sternocostal joint is the joint between the manubrum of the sternum and the rib, and that joint is made possible by the first costal cartilage. You can see the costal cartilage here uniting the rib, first rib, and uniting it with the manubrum of the sternum. This joint is a primary cartilaginous joint, or what we call a synchondrosis, and the reason for it is because the type of cartilage we see is hyaline cartilage. That hyaline cartilage is the costal cartilage uniting both of the joints or both of the bones or forming the joints. Then we have the second to seventh sternocostal joint. Second to seventh sternocostal joint is the joint between the ribs, the second rib, all the way down to the seventh rib, which are the true ribs and the sternum. So this joint is also made possible by the costal cartilage between them. And that joint is an example of a synovial joint. So second to seventh sternocostal joints are synovial joints in nature. Then we have some very unique joints known as costochondral joints. Costochondral joints are joints between the ribs and the costal cartilages themselves. So the costochondral joints are primary cartilaginous joints or synchondroses, similar to what we saw for the first costal joint. Then within the costal cartilages themselves are joints. So the costal cartilages themselves are made up of joints, and the joints within the costal cartilages are known as interchondral joints. So interchondral joints are synovial joints in nature. This is a very unique concept. So the costal cartilage, even though it's a costal cartilage itself, has a joint within it, and that joint is synovial in nature. Then we have the costovertebral joints. Costovertebral joints, the joint between the head of the rib and the body of the thoracic vertebrae. The costovertebral joint is a synovial joint. And then finally, we have the costotransverse joint. Costotransverse joint is the joint between the tubercle of the rib and the transverse process of the vertebrae. And that joint is also a synovial joint. So we have mostly synovial joints, followed by the first or followed by the primary cartilaginous joint or the synchondrosis, and then followed by the secondary cartilaginous joint or the symphysis. So let's complete the model by talking about the apertures of the thoracic cage. We have two major apertures to the thoracic cage, or two major openings to the thoracic cage. This includes the superior thoracic aperture and the inferior thoracic aperture. The superior thoracic aperture, like I said, is the part of the opening to the thoracic cage that connects it to the neck. It is heart-shaped in form, and it is formed or bounded by three major structures. So it's bounded anteriorly by the manubrium of the sternum. So you can see the sternal notch of the manubrium bounds it anteriorly. It is bounded by the superior border, or rather the superior surface rather of the first rib and its costal cartilage. So you can see that superior surface of the first rib and costal cartilage bounding it laterally, and then it is bounded posteriorly by the first thoracic vertebrae. So these are the boundaries of the superior thoracic aperture: anteriorly by the sternal notch of the manubrium, laterally by the first rib and its costal cartilages, and the first thoracic vertebrae bounding it posteriorly. It is covered partly by a very important structure known as the Simpson's fascia. Simpson's fascia is just a small or minor covering that tends to protect the opening to that of that superior thoracic aperture into the thoracic cavity. The second opening of the thoracic cage is the inferior thoracic aperture. It is formed by different borders of the bony framework of the entire thoracic cage. So the boundaries of the inferior thoracic apertures include anteriorly the xiphosternum. The xiphoid process of the sternum tends to form the anterior boundary as shown in the image here. Laterally, it is bounded by the 7th to 12th rib, so the inferior borders of the 7th to 12th rib and their costal cartilages. And then posteriorly, it's bounded by the 12th thoracic vertebrae as shown here. This is the inferior border of the 12th thoracic vertebrae. The inferior thoracic aperture, unlike the superior thoracic aperture, is covered almost entirely by a muscular structure. So like we discussed in the superior thoracic aperture, that's covered by a membrane-like structure known as Simpson's fascia. For the inferior thoracic aperture, the structure covering it is the musculotendinous structure known as the diaphragm. The diaphragm is one of the few topics we'll talk about in this particular module under thorax. And that concludes our module on the thoracic cage.